So you found out you have a bulging disc. I have 14 years experience working with clients with bulging disc and helping them avoid surgery. So let's get you actionable information. Let's get it today. The first thing we got to talk about is, are bulging discs static? Are they permanent? So a bulging disc happens when we go into flexion. So this is the spine. It would be angled this way. We would be going into flexion right here with the spine, but turning it the other way, you can see, so this is flexion on the front side. This is the back side of the spine. When I go into flexion, I make that disc bulge come out the back. That will take up space for that nerve and causes problems. Now, what happens if we go into a lot of extension, which is called the McKenzie technique, we go into extension, we close down that space for the nerves, but we do it with the bones right here. So what we want to do is have pressure coming straight down on the spine. We keep the spine in a neutral position. So I push straight down like this. I still have a little bit of a disc bulge, but it's not nearly as much as if I go into flexion. That really pushes it out. And what we've found with clients through MRIs is that their disc bulges are not static. Their disc bulge is actually, it's malleable. It's changeable by the way that we put stresses on it. We had a client that went from an 8mm disc bulge down to a 4mm disc bulge. So it improved by 50%, but it's not perfect, but 50% improvement gets them out of pain and he's avoided surgery. And so it's a really impactful thing to start learning about the disc and know that you're not broken. These are things that you can get through. We can get you out of pain by doing very specific stuff. We have a ton of videos on, which in the description below, you'll find more videos on this of how we treat a disc bulge. Why are disc bulges happening is that we do this all the time. Wiggle, wiggle, wiggle through our back. And it's like, when we wiggle through our back too much, we're causing more and more stress on it, and we're making that disc bulge pop out. We're making our body produce inflammation down there. Chronic inflammation, good inflammation, it comes down, it heals the tissue, and then it gets out. Chronic inflammation actually causes more disc bulges, it causes bony overgrowth and more arthritis to set in. And that happens when we look at the spine right here. We have a path of least resistance. So we have that, the body ends up breaking down fairly simply, is that the neck is exposed. We just have muscles around it. At the thoracic spine, we have the rib cage, we have joint capsules, we have 9 muscles that overlap, and we have the shoulder blades. We have a lot of stuff going on right here. So there's a lot of stuff to get stiff. Then at our lumbar spine, we're exposed again. So it's another path of least resistance. It's an easy area to move. It's an easy area to actually just cause extra stress and get more inflammation and more disc bulges. And we want to limit that, because when we get to the pelvis right here, there's a lot of stuff going on. So there's a lot of things that get stiff. So if I'm getting stiff here and I get stiff right here, and this is a very easy place to move, then we're gonna end up moving too much right here. We wear out that disc and we cause these disc bulges. The most common area for a disc bulge in the low back is between L4 and L5. And the most common area for a disc bulge in the neck is between C5 and C6. What do they have in common? That we have a stable base right here. The first segments that move on each other are C5 and C6. And in the low back, the first segments that move are L4 and L5. And we're coming from a stable base. We're coming from an area that starts to get stiff on us. That's why hip mobility is really important and thoracic mobility is really important. If we want to take stress off of that disc, we have to redistribute that stress, and we have to put it up in the thoracic spine by getting mobility right here and getting it into the hips. We're getting hip mobility and pelvis mobility. And then we've got to keep our spine in a neutral position. If we do that consistently, then you're going to allow that disc bulge to go back in. It may not be perfect, but it's going to go back in. It's going to create space. And if we do that consistently, we're going to get rid of the inflammation. We're going to make sure that you're moving in the right direction and getting yourself out of pain. That's really the focus. Are we focused on cutting the disc and going straight to surgery, or do we want to get out of pain and preserve our body long term? That's what we do here at the clinic, is we help our clients create the space, get stronger in the right areas, and work on mobility in the correct areas as well. When we do that consistently, you're able to get rid of your disc pain, also create the space so that you can keep those results and make sure that you're getting better and better on a weekly basis. A lot of our clients have 50 to 80% improvement within the first 2 weeks. So when you're doing this, make sure, the biggest problem that I see is very conceptual, is that somebody tells me that they're doing hip mobility exercises. So if I'm doing hip mobility and I'm doing an exercise like this, right? So I'm working on hip mobility right here. As soon as I go down in this stretch, now you're seeing I went into hip mobility, but my hip stopped moving, and now my low back is moving. So I'm actually crimping off areas in my low back by overdoing it. So if I was doing a stretch like this, I would want to stay here and make sure that my spine stays in a neutral position. If I lose that neutral position by going too far, then I'm actually working on low back mobility, and we want to avoid that. Another thing that I've seen really often here in the clinic is when somebody tells me they're working on hip mobility, they'll lay down on the ground. I say, hey, show me what you're doing. They say they're working on hip mobility, and they'll do this, and they'll turn their body to the side. And you can see I got the same problem right here. Now I'm moving through my low back. I'm not working on hip mobility, I'm working on low back mobility. So when we're doing exercise programs, when we're trying to fix a disc, we want to make sure, you've heard about decompression. There's no evidence that I've found that says that decompression actually works. The best thing that you can do is redistribute stress up into the thoracic spine, into the hips, and decrease load on the low back. And we do that by keeping that in a neutral position and making sure that when you're working on hip mobility, you're actually working on hip mobility. You're not over moving and creating problems through the low back. And the same thing, we're working on thoracic mobility and we're not twisting up in our lower back. That's what I see with our clients a lot of times is that they think they're working on hip mobility, but it just doesn't get any better. So make sure you check out the videos down below and leave us a comment on exactly what you want to see in the next video so we make sure that you're getting results from home. We'll see you in the next video.